Hello my dear, welcome here again. Today we are going to look on the changes encountered by a woman during pregnancy as well as the pregnancy stages. If you are pregnant, your body is experiencing major change. From symptoms that you might expect, to ones that are completely unexpected, every woman will have a different pregnancy experience. It's helpful to have an idea of how your body may react to the different stages of pregnancy. It also helps to know how pregnancy may affect your emotions and feelings. Let's start with the changes first. Changes to your body that may indicate pregnancy. You may first realize that you're pregnant when you miss your period. That's a good time to take a pregnancy test or speak with your doctor. In early pregnancy, you may experience some, or all, or even none, of the following symptoms. Aches and pains possibly in your lower abdomen and in your joints, morning sickness, which may be nausea or actual vomiting, and does not just happen in the morning. Constipation. Food cravings and aversions. Heartburn and indigestion. A need to urinate, pee, more often. Back pain. Tiredness. Vaginal thrush. Skin changes and itching, and possibly skin tags, leg cramps. Restless legs, leg twitching at night, varicose vein. Swelling in your ankles, feet and hands, dizziness or fainting. Fatigue, or lack of energy. Nasal problems, or shortness of breath, larger, tender breasts. If any of the symptoms become difficult to manage, talk to your doctor about what to do. In particular, if any morning sickness, aches and pains, dizziness or breathing difficulties make it hard to get through your normal day, ask for advice. Morning sickness. The first thing to know about morning sickness is that it can hit you at any time of day. Probably a result of your changing hormones, it usually starts about week 6 and settles by week 14. The good news is that you may feel better if you drink small amounts of fluid, often. Try flat lemonade, sports drinks, diluted fruit juice, weak tea, clear soup or a hot drink made of stock. Suck on ice or ice blocks. If you can't keep down other fluids, try ginger tablets, dry ginger ale or ginger tea. Eat small amounts of food more often, so you don't have an empty stomach. Eat a dry biscuit when you wake up in the morning, to avoid feeling sick when you get out of bed. Try salty foods such as potato crisps or salty biscuits. Suck on barley sugar or boiled lollies. Avoid fatty, rich or spicy foods. Avoid the smell of hot food. Avoid cooking dishes with strong smells. Rest as much as you can. A small percentage of women have prolonged and excessive vomiting, called hyperemesis, which can lead to dehydration if it is not treated. See your doctor if you have severe morning sickness. In some extreme cases, women need to be rehydrated in hospital, using intravenous fluids. We are done about the changes, my dear. Yes, let's also be together again in discussing about the pregnancy stages. Pregnancy stages. We talk about 3 stages of pregnancy: first trimester, second trimester and third trimester. Some physical and emotional experiences are more common in each of these trimesters. First trimester. In the first trimester, you feel tired and possibly nauseous, like vomiting. You gain 1 or 2 kilograms, or maybe less if you have morning sickness. Most of this weight is in the placenta, which feeds your baby, your breasts, your uterus, womb, and the extra blood that you are making. Your heartbeat and breathing rate are faster. Your breasts become tender, larger and heavier. Your growing uterus puts pressure on your bladder, so you feel like you need to urinate, pee, a lot. You may feel swinging moods. You know exactly how you feel about having a baby, or you have no idea how to feel. Second trimester. In the second trimester, you start to feel better, with less tiredness, morning sickness and moodiness. You may feel your mind is wandering and not focused at work or at home. You gain about 6 kilograms. You may feel anxious about tests, including an ultrasound, done at this stage. But, if they find any health issues, these tests will ensure you and your baby receive the right care. Your hair may become thicker and your fingernails may become stronger. Or, your nails may be softer and break more easily. You may crave some foods, such as sweet, spicy or fatty foods. You may not like the taste or smell of some foods. Third trimester. In the third trimester, forgetfulness may continue. You feel tired and probably uncomfortable. You may be annoyed by the discomfort. You may start to worry about labor as it nears. You probably gain about 5 kilograms. Much of this weight is your baby, but also amniotic fluid, the placenta, your breasts, your blood and your uterus. You may have back pain. You may find it hard to sleep because you are uncomfortable. The baby may be placing pressure on your lungs, making it harder to breathe. You may feel Braxton Hicks contractions, tightening of the muscles of the uterus. They do not mean labor is starting. Thank you for watching our video. Remember to subscribe and give your comment at end before you leave.